So Mpox is clearly a cause of concern, primarily because it is spreading at a rapid pace in many parts of Africa, now even beyond Africa. For more on this, let's bring in Dr. Patrick Otim. He is an emergency response officer at the World Health Organization Regional Office for Africa. He joins me now live from the Republic of the Congo. Great to have you here with us on TRT World. I want to take a step back. Tell me, how does Mpox differ from other viruses?
Thank you very much, and good to be with you speaking to the audience this morning. So Mpox, as we know, is a zoonotic disease. It's a viral infection, which is very contagious, and it spreads from one person to the other, largely through contact. Now, Mpox, the incubation period, when somebody comes in contact with someone who has Mpox virus, it takes between 2 to 21 days, but mostly 13 days for you to begin to show the signs and symptoms. Now, what are the common signs and symptoms? As you have been showing through your videos, the common sign of Mpox is the skin rash or the lesions that appear sometimes in the mouth, in the skin, or in the genital area. Now, this rash is also accompanied by other signs, including fever, swelling in the neck, what we call the lymph nodes, in the axilla, in the armpits, in the groin area, behind the ear. There is general weakness, there is a muscle pain, but this rash is very characteristic, which is one of the things which is different about other viruses. Now, the rash usually starts on the face, and then it spreads to other parts of the body. And it moves through 4 stages. Usually the rash initially is flat, then it gets raised a little bit, it gets filled with a fluid, what we call a vesicle, then it gets filled with a pus, and then from there it breaks and the fluids start coming out. And at this point is when the person is very infectious, because if you come in contact with that fluid, then you can catch the virus. And then after this fluid breaks, it now forms crust, and then the skin begins to heal. So within 2 to 4 weeks, you can go through this process of the healing of this rash, and then the new skin will begin to be formed. Now, normally, most of the people with Mpox will recover quite quickly, but some of them do develop severe disease, and some of them can die. Now, who are the people at risk of severe disease? You have the children, because of their low immunity, are at risk of severe disease. People with immunosuppression, diseases that affect the immune response, like HIV, people on cancer treatment. These are people at risk of severe disease. And lastly, then, Mpox can also result in death, particularly if the people do not get appropriate supportive care.
Okay, now, Dr. Otim, here's the thing. The World Health Organization declared Mpox a global health emergency in the past as well. Do you think this declaration has translated into real action, or are we seeing a disconnect between policy and on-the-ground action?
No, I would say that on the contrary, I think we have seen a lot of action from the member states. First, to begin with, I think all the countries have taken the declaration of the Mpox as a public health emergency of international concern very seriously. We have seen response actions being ramped up in Burundi. We have seen response actions being ramped up in the Democratic Republic of Congo, which is the epicenter, but also all the other 14 countries. So all the countries are taking Mpox as a very serious public health threat. And also, more importantly, the global health community is coming together, and support is being provided. And as you had mentioned, we have seen the first doses of vaccine donated by the European Union arriving in DRC. We have seen resources, countries coming up, like the United States government has availed resources to support the response. So I believe that the declaration of Mpox as a public health emergency of international concern is being taken seriously, both by the countries concerned, affected, but also by the international community.
But of course, one major problem here is growing vaccine equity. Wealthier nations, as they always do, are stockpiling vaccines, while African nations are grappling with the rising cases of Mpox. See, here's the thing. I wonder, why is this issue repeating itself? Why does this issue exist in the first place? And what is the World Health Organization doing to resolve it?
So there are largely 2 issues. For a disease which is re-emerging like Mpox, you will notice that most of the production there has not been production of vaccines, let me say, on a large scale or other countermeasures for Mpox. So there were very few manufacturers that were still working on the smallpox, because most of the vaccines we have now are repurposed smallpox vaccines. So because smallpox had been eliminated as a public health disease, we had issues in terms of the no need to continue to produce vaccines. Now, when we have a disease like Mpox, for which we are using the smallpox vaccines, there was largely no global production. So there was already limited capacity to be able to produce. And when we had the outbreak in 2022, understandably, countries will prioritize their own populations to be able to buy the vaccine. So you have many countries wanting to buy the vaccine and very few vaccines available and very few manufacturers making these. Now, what WHO is doing is trying to work with researchers, first of all, in the research and development, to be able to support the rapid acceleration of development of newer vaccines that can be able to address this issue. But secondly, also through the emergency use listing of the vaccines, WHO is trying to make the vaccine accessible through the pooled procurement mechanism that is done by the Global Alliance for Vaccine, Gavi, and UNICEF, so that these vaccines are available for the poor countries. But I must add that it is true that we do not have sufficient doses available, for instance, for countries in Africa, and I would appeal that there is need for more investment in research and development. There's more need for more investment in the production of vaccines and allocation. Countries that have a stockpile of vaccines to be able to donate more, like we have seen with the European Union, to be able to donate more vaccines to help other countries in Africa that urgently need these vaccines.
Dr. Otim, fascinating insights. Thanks very much for joining me here today on TRT World. I really appreciate your taking out the time.